Silvanaka, welcome to Speak Your Mind on Gold FM as well as FBC TV. I'm Rita Narayan. Today we're talking about Fiji Network Plus, also known as FJN Plus, a support group for persons and advocacy group for persons living with HIV. And we're also going to be talking about a recent study that looked at the experiences of treatment among people living with HIV in Fiji and in the Pacific Islands. And in studio with me today is Choeli Dolati, an advocacy and education officer with FJN Plus, as well as Vani Dulaki, who is the executive director of FJN Plus. Welcome to the program. It's good to have you here today. Now, firstly, before we begin, if you have any questions for either of our guests concerning their work as a support group for persons living with HIV/AIDS, or as well as the outcomes of this study, you can send us the questions on goldfm@fbc.com.fj. We're also on Facebook on Gold FM Fiji, or you can also call us on 3220-906 or 3220-907. Now, Vani, firstly, the FJN Plus or Fiji Network Plus, tell us a little bit about the work that this support group does, this organization does.
Thank you very much, Rita. In 2003, a collective of 9 people who were newly diagnosed with HIV decided to set up the organization to provide support for those living with HIV. Yeah? And this group of people started up with working together to find ways of helping their peers. And in 2004, the organization was formally established under the Charitable Trust Act of Fiji at that time. And the main focus of the work of the organization is to do advocacy and education. We also have a membership support program that looks after the needs of people living with HIV. At the same time, we run a livelihood project where we're trying to build the capacity and the skills of people living with HIV who are unemployed and needing financial assistance, and trying to build the capacity to do their own businesses or develop their own livelihood activities. And the other project that we look after, or we have been working on, is the hardship grant. The hardship grant is a pot of fund that we try to find from different sources that will help us to support people living with HIV. For those that have children, we would like to help them before we start to refer them to other big organizations who can provide that kind of support. It's for their children, and also for children living with HIV that have been made known to us. The other one is to try and support the purchase of medication for those that are living with HIV. We know that the ARV is provided for free from the Ministry of Health, but there are other times when each one of them may be faced with opportunistic infection where the treatment has to be purchased outside of that support. And also transportation costs for them. Most of the people living with HIV will need to come to the doctor every month, and that is sometimes difficulty for most of them, so we try to help them, ensuring that the finances are available to get them to see the doctor, get all the treatment that they need, and also pick up their medication. And the other part that we have been supporting members with is shelter. This is something that we're really looking into seriously, because there are some people that are still being pushed aside, then being denied into family homes. So the need for shelter is very important for us.
Mm-hmm. Now, talk about the membership. How many members do you currently have, and how are you going about your membership drive?
Okay, for our members, we have 49 registered members at this point. For us, it doesn't mean that anyone who's diagnosed with HIV becomes an automatic member of it, because that's the choice that people should be able to make for themselves. And out of the 49 members we have about 80% from Suva and 20% are from Lautoka. And we have just established, with the partnership with Ministry of Health, we've got now an HIV advocate in Lambasa, who is going to help us bringing people together so that the support that they need is going to be made available to them.
Mm-hmm. Now, Vani, can you talk about the funding for FJN Plus? Where do you source it from? Because globally we know now that the trends are that funding for work on HIV is diminishing. Is that in any way affecting your work? And what kind of support are you getting locally to support the work that you do?
Yes, thank you, Rita. We are all aware of how the funding for HIV is coming out. We would like to, right at this instance, thank the Fiji Community Development Program that has come in and provided us support for 1 year at least. But we are optimistic with our relationship with them that we can continue the support so that we can continue to do the work that we wanted to do. For at the moment, we are funded under the Fiji Community Development Program, which is a funding mechanism of the AUSAID, the Australian government. We used to get funding. We get pockets of fund from the Ministry of Health in terms of implementation of specific activities that are in line with the National Strategic Plan. So we work with the Ministry of Health to help us with that activity. And also we have our partner outside of the Pacific, the Asia Pacific Network. They have been also very supportive in looking at the needs of the organization and the members and providing support in that sense.
Mm-hmm. Now, can you talk about some of the livelihood programs that you mentioned? What sort of things are you helping your members in terms of, is it finding employment or looking at alternate ways of earning income?
Yes. For the Livelihood Project, it has been a project that has been going for a number of years now. We have had like any other project, some teething problems and some ups and downs, but we're now looking at a different way of addressing it. So in our activity last year at the end of the year, our annual retreat, we tried to assess the skills that are already available with the people that we work with, our members, and asking them questions like which one of these you would be able to use or like to use or continue to use to be able to find a source of income for yourself. So that we have done, and we're having it ready now. And now what we're looking at is how are we going to get them in and finding expertise outside that can help enhance these skills so that they can see it as a source of income for them and their children or their families.
Okay. And in terms of meeting the accommodation needs of your members, you did mention that you're trying to look for housing because there's still cases where persons living with HIV are discriminated. They're isolated from their family members. Do you have a safe halfway house, or what exactly are you doing?
Well, currently we have a halfway home, which we are now trying to repair the home and make it more livable for human beings. But at the same time, when we have individuals or couples in the situation that we've just had, that we try to discuss it with their families and the Turangani Koro, if they're living in a village, to see if it's okay for them to build their house. And so what we do out of the hardship grant is that we put out a little bit of money. In the case that we did this year, we even negotiated with Vinod Patel if they could give us a reduced price so that we can help build this couple a home that they can live in. So that happened, and we also got some help from UNFPA with materials that they had that could be used to help build this house and make it livable.
Okay. Thank you very much, Vani. We'll take a short break and we'll be back in a moment. Welcome back to Speak Your Mind on Gold FM and FBC TV. I'm Rita Narayan, and today we're talking about the work of FJN Plus, as well as the recent study that was carried out on the experiences of treatments among people living with HIV in Fiji as well as in the Pacific Islands. And in studio with me is Vani Ndulaki, Executive Director of FJN Plus, as well as Choeli Dholati, who's the Advocacy and Education Officer also with FJN Plus. Now, Choeli, you recently participated as a peer researcher in this study that had some very interesting findings that looked at the experiences of people living with HIV in terms of the treatment that they have received. What was the scope of the work that you were required to do?
Well, thank you, Rita. The study was a brainchild of Myra Bobe, and I believe that most of us, the listeners, we know Myra and also the work that she does in the Pacific. A positive woman who play a role in ensuring that ARV became a key part of the Pacific response in to HIV. The study was conducted under the auspices of the Pacific Island AIDS Foundation, with the funding supported from the Secretariat of the Pacific Community through the Response Fund, to be able to know how people living with HIV were reacting towards treatment and the kind of support needed to ensure adherence to their treatment. The study was a participatory research project, and along with other peer researchers were involved in the various stages of the project. The project began in 2010 when we were approached to be part of the study process. For most of us, especially in Fiji, this was a first. However, the project included capacity building for peer researchers on skills to develop questionnaires, interview skills, and analysis of data collected. In all, Ms. Hilary Gorman, who was the project officer responsible, guided us through the whole process. After all the training, the peer researchers went through to prepare them for the project in November 2012, developed the research methodology to be used. The study covered Kiribati, Fiji, Guam, Solomon Island, and also in Samoa in 2012. And the report was officially launched on this day, June 2007, by His Excellency the President of Fiji, Ratu Epeli Nailatikau, attended by partners and stakeholders throughout the Pacific.
And what specifically were you required to do? What did the study involve?
The study involved collecting information on treatment and also the experiences of people living with HIV, and also the experiences of people living with HIV on accessing the health services that are provided.
Now you have, of course, the issue of ethics approval, because here in Fiji there really is nobody that would look after this. How was that addressed?
At that time, when we were planning the research in Fiji, the ethics committee was still meeting, and we were able to get approval from both the National Health Research Committee and the Fiji National Research Ethics Review Committee. But the process did take a few months. For Kiribati, Samoa, and Solomon Island, approval was granted by the Ministry of Health, except for Guam. It was the university which has the ethics committee to guide any human research conducted in the country.
Now, before we go to some of the findings, what were some of the limitations, to the kind of work that you were doing? Because you were gathering information.
Yeah. Some of the limitations were the study unfortunately did not include people living with HIV, who were not able to reach because they may have changed addresses and also contacts without informing the health centers. And it also did not include people living with HIV who are only accessing private health service. However, the study, even though the study had regional Pacific Island focuses, yet did not include all of the countries. So for the countries that were not included, we can only say that the situation are likely similar there.
Now, if we go on to the findings of the study, are people aware? Were people aware of the HIV treatment and its availability? I mean, according to what you were able to assess?
Well, in the Pacific, ART or the treatment was made available to people living with HIV in early 2000s, and several years earlier for those living in the Pacific Island territories. Many people living with HIV were not aware that treatment was available. So when they were diagnosed, there was a sense of hopelessness and shocked, especially with the information that came in with HIV. Once people were able to get over the initial shock, they were reassured treatment is available and they can be provided with it through the Ministry of Health.
Mm-hmm.
And some people were diagnosed in the late 90s and early 2000s before ART available, did not have reassurance. But we glad when treatment did became available and are still alive today.
Mm-hmm. Vani, perhaps you can talk about what FJN Plus is doing in terms of creating this awareness, not just amongst your members, but in the work that you're doing, the advocacy work that you're doing, and creating the awareness when you go out into the communities.
Nakarita. Yes, some of the members that we have were very concerned about the side effects of the treatment, and at some point in time they did not want to take any more treatment because they were not sure of how it was helping them. So for FGN Plus, we are now looking at developing brochures, where we are talking about the different types of treatment that is available and also the importance of adherence to treatment. Some of them thought that, it was, as soon as they take the treatment, it will take away the virus from their body. But this is now, we are reassuring them that it will never leave your body once it's in, but you can control it, the work that it does in your body. And that's why it's important for you to take the treatment.
Mm-hmm. Okay. Jolie, what were some of the other findings?
Well, some of the findings that we have in the reports, the study cover 5 major areas. One is to do with diagnosis and medications, and the second one is meaning and attitude to treatment and health service, ART adherence, and lastly on alternative therapies. Overall, it was found that ART or the treatment had a positive impact on the lives of people living with HIV in the Pacific. But there are also challenges in better understanding of some of the side effects, the limited or the support from home to be able to get treatment, and even adherence, the distance between home and where the ARV is available. People become financially dependent on families and also friends.
Okay, that's an interesting note to end this segment, and we'll be back in a moment. Welcome back to Speak Your Mind on Gold FM and FBC TV. I'm Rita Narayan, and in studio with me are Vani Ndulaki and Choeli Volati of the FJN Plus or Fiji Network Plus. And before we went to the break, Choeli, you were talking about some of the findings of this study that was carried out here in the Pacific, including Fiji, on the experiences of treatment amongst people living with HIV. And you did mention some of the issues such as accessibility to treatment, the long distances that people had to travel to get to health centers. What else were some of the interesting findings of this study?
Well, some other findings that we have is the confidentiality. The confidentiality of people living with HIV is still breached, and also some of the interviewees mentioned that in terms of meaning and attitude of treatment. In describing the meaning of treatment, most of the interviews said that it's prolonged life, and gave them hope. It also meant that they could resume their normal daily work. So for them, treatment, the meaning of treatment is very, it's known to them. But some other finding in terms of counseling was generally described as being offered to participants who are diagnosed after the mids of 2000s. It was noted that being important in helping to deal with their diagnosing HIV positive.
Mm-hmm. And what were some of the apprehensions that people had about treatment and accessibility to it, availability?
In terms of accessibility and accessibility to health services. The study, it's clearly stated that the PLHIV needs support. It needs support in terms of family support on how to address these issues. Not only to access the services, but in terms of adherence to their treatment. Family support is one of the findings that indicate that's a required or a need from people living with HIV.
Vani, would you like to talk about maybe the kinds of work that you're doing in terms of maybe educating family members, community members about the importance of supporting persons with living with HIV, not just financially, but also emotionally and in other ways as well?
Yeah, thanks, Rita. I think that cannot be ignored, the family support. The family support is very important for any illnesses that anybody gets. If the family is not supporting that individual will not be able to get better, even with all the kinds of medications that we have. So in terms of HIV, that is one of the things that we encourage. We are trying to, through the education programs that we are running and facilitating, we're trying to bring families back together. There are some situations where there's been a difficulty, but it's mostly on personal issues that as families we can sit down and talk about it and come up with an answer to how we can support each other. For some families, we found that the individual who's living with HIV is very well supported. They're making sure that their food that they're taking is nutritious and it will help them with the immune system. When it's time for them to go to the doctor, the family would make sure that is done, or she or he is taken to the doctor and the medication is collected, or even when the individual who's living with HIV is unable to go to the doctor, we have had families call up and say, can you please ask doctor if I can come in and collect his or her medication. So we have been able to do that, and we're very thankful to the doctors at the hub centers who are very supportive. And as soon as we say, hey, it's from FJN Plus, this person is needing medication, but she cannot come, can you give it to the family? They said, okay, that's fine. Or otherwise, the family might still be hesitant to be seen in public. So we would go up and collect the medication and bring it and pack it and then put it on the bus to send it to the couple or to the people. Or the family then can come and visit us and we will give them the medication. So the support of the family is unquestionable. It's very important, because if we're saying that that's the basis of society, then society needs to be able to show that it is.
Okay. Jolie, did you?
Sorry, Rita, while we're still talking on the access to health service, initially there was a lot of hesitations by people living with HIV to access health services due to stigma and discriminations. But today this is slowly changing as healthcare workers are becoming more informed about HIV and AIDS and understand the issues surrounding it. But in the study, many interviews said that experiences of quitting ART or treatment and focusing on alternative therapies and realize that they cannot be cured, which is something that we have to be mindful of while we're reading this report.
That the issue of alternative therapy is definitely, I have a question that I'm saving for later on. But what about the impact that ART has had on persons living with HIV?
Well, antiretroviral therapy or ART, or some we call treatment, prolong and save the lives of millions of people living with HIV. And it was noted that to have a very positive impact on the lives of people living with HIV. People said it's helped them to live, regain their health, be with their families. But there are also challenges. Some of people experience side effects, which can be difficult to deal with. Others noted that being on ART also mean ongoing medical follow-up.
And there's also some concern about not getting the proper information or not having that access to information on ART. That was also an issue that arose in this study as well.
Yeah, I think that's really important to bring out. And the thing is that the need to ensure that people, like any other medication, there would be side effects. And if that is made clear to every individual that even diagnosed with HIV, that it is the same with any kind of illnesses, then I think it would be easier for them to take on the medication that has been provided to them at intervals that they should be having it. Yeah?
Okay. Thank you. We'll take a short break and we'll be back in a moment. Welcome back to Speak Your Mind on Gold FM and FBC TV. I'm Rita Narayan. Once again, our studio guests today are Choweli Dholati and Vani Dulaki of the Fiji Network Plus. Now, before we went to that break, we were talking about information on treatment, or ART as it's also known. And something that you raised was concerns about side effects. And there's also the assumption that everybody would have the same sort of side effects. Would that be?
Yes, for people living with HIV, with different drugs have different side effects. Yeah? But for the experiences that we've came past, or that we've came about, is people living with HIV have different side effects. Yeah? Some have experienced dizziness, losing weight, and also vomiting while taking their medication, with different people living with HIV with different side effects.
Mm-hmm. Now, let's talk about alternative therapy. What were some of the findings in the study, and how widespread was its use, according to what you were able to assess?
Well, for alternative therapies, many people turn to, in the study, it stated that many people turn to alternative therapies in hope of being cured of HIV. About 50% of the interviews confirmed that they had tried alternative therapies and quit ART or treatment, such as faith healing and also herbal remedies. Many interviews shared that their experiences on quitting ART and focusing on alternative therapies, and realized that they cannot be cured on HIV, but only symptoms. Some of them put this to learning experience and are strong advocate for, especially for the newly diagnosed people, to ensure that ARV is adhered.
How much of a pressure was there on the people to use alternative therapies from families, from friends, or maybe from others? Other PLVs?
In the finding, majority from the family members. They've been forced to take natural remedies or herbal medicine in order to cure their HIV infections.
Mm-hmm. Vani, what is the FJN Plus's stand on alternative therapies?
For FGN Plus, it needs to be cleared. The alternative therapies are only treating the opportunistic infection, so it does not take away the virus from one's body, and that's what we want to make clear to everyone out there. If there is someone coming around with a bottle of some mixture of something, it might help you get better. It might stop your diarrhea. It might take away the rashes you're getting, but it does not take away the HIV. And that's what people need to know. The only treatment that is known being scientifically proven is the ARV. So we need to just go back to ARV. If you are having diarrhea that you're not knowing how to stop it, maybe some medicinal herbs would be good, but that does not mean you stop your ARV.
Actually, just interesting, some of the comments that some of the participants who were interviewed mentioned that people actually came to them and said, we have something that would cure you.
Yeah. In the finding, it stated there that people are coming in to force them that we have the cure for HIV, and they are being easily, what I can say, easily, taking that natural remedies, and without without having that information, or without having that information that only ART is there or is available, that can prolong your life. I believe because of the desperate that they have, that majority of the interview that they went for natural remedies or for alternative therapies.
And the ones that you interviewed, they've stopped taking them?
Yes.
Okay. Now, let's talk about the recommendations of this report. What were some of the recommendations, and what is FJN Plus doing to address them and to further what the recommendations say?
Thank you, Rita. Probably I'll talk on the recommendation that we have in the report, and probably Vani our executive director, will talk on what is the role FJN Plus can play in terms of this recommendation. The report includes 8 recommendations. Firstly, it's stated to decrease the fear surrounding testing by providing more information that address fear of dying, so that people understand that medication is available to treat HIV. And the second recommendations was to continue to educate people living with HIV about treatment, in understanding that the benefit of ARTs or ARV treatment, coping with side effects, and also the importance of viral load and CD4 count test. Thirdly, the need to train and build capacity of the Pacific health workers on the importance of confidentiality, non-judgmental care and support to people living with HIV. And fourthly, the need to improve access to ARV, CD4 and viral load testing, and ensure that service is available beyond the urban health centers. Fifth, the need to ensure that family of people living with HIV are educated on how HIV is and not transmitted. The sixth one was the need of funding, the need of continue of funding and supporting people living with HIV network, so that they can be able to continue to offer the support services to people living with HIV, to their families, and also to educate the communities in terms of treatment, care, and also support towards people living with HIV. Second last was to ensure that the Ministry of Health are slowly integrating the cost of ARV or the treatment into their main budget. And lastly was the future research to include HIV treatment adherence, to explore people living with HIV, not only people living with HIV, but also focus on the doctor-patient relationship, and also the view of health workers as well, to understand the constraint that they work under.
Okay. Vani, that's quite a lot of work cut out for FJN Plus.
Yes, Rita. We're very thankful for these kinds of reports that are specifically targeted towards PLHIV. So most of these recommendations that are coming out, we are already trying to do work in that area. And one I just want to highlight is the testing, the World Testing Day for this year, where we've done a poster where we are asking people of behavior that puts them at risk of HIV. And this has been generally well supported by the community. And in one of the women that came around to our Bula festival said, this is one good way of telling people what to do.
Okay, we'll come back in a short moment. Welcome back to Speak Your Mind, and we're in this final segment of this Talkback show on Gold FM and FBC TV. I'm Rita Narayan, and in studio with me are Vani Ndolaki and Choli Velati of the FJN Plus, or Fiji Network Plus. And before we went to the break, Vani, we were talking about some of the recommendations that were made in this study, and one of the areas that we were talking about was testing and decreasing fear around testing. And you mentioned, that you had an activity out during World Testing Day. What else have you got scheduled in terms of addressing these recommendations?
Okay, one of the things that we've done, Rita, is we've gone into partnership with Vodafone. They have agreed to provide us with a booth at 3 festivals that are held around the country. We've started with the first one at the Mola Festival in Nandi. Next, in 2 weeks' time or 3 weeks' time, we're going up to the Friendly North Festival, and then the last one will be the Sugar Festival. This is an effort for FGN Plus to take these issues out to the community, and because in the past it has always been concentrated here in Suva. So in terms of us being there at the community level during the festivals, our main aim is to try and allay the fears that people have about HIV, so that when people recognize the behavior that puts them at risk of HIV, that they will feel comfortable to go and ask for a test. And in the past, since we started this year, we've had some very good positive responses from the community. In our World Testing Day activity, people have been looking at our posters, and like I said, these are the questions. One of the comments that came was, these are the questions that people do not want to ask themselves, but by putting it in a poster and allowing people to read it for themselves, makes them really think about how their behavior puts them at risk of HIV. And we've also wanted to, with the Fijian radio program that we have been involved in, we've used that very well to get the information out to the people. And again, we've also got some very positive feedback from those who are listening into the program, saying now they understand how HIV is transmitted and how it is not transmitted. So that for us is really is a boost to our morale in terms of the strength that we get to continue the work that we're doing. But 2 days ago, I had a meeting with someone who was in Taveuni 3 months ago, and was telling me that in Taveuni she was asked again if mosquitoes do transmit the virus. And again, the education will never be able to stop. We'll have to continue to do this, and we'll have to continue to reach out to the different parts of Fiji so that people understand the whole issue surrounding HIV. And I think once they know that, then they can provide the support that they need to provide to their family members, to their community members, or to their friends. So those are some of the things that we're doing. In terms of training and building the capacity of health workers, we have been working in partnership with the Fiji National University through the College of Medicine, and in partnership with the Albion Center. We're really looking forward to working with the health workers when that project starts rolling out, I think, towards the end of this year. So we want to be able to work much more closely with the healthcare workers. In terms of the families, again, like I've said, we're using these radio programs to really reach the families, because, and we've also said, if the family is the basis of society and where the society begins, then we need to really think about how we are seeing families and how we are behaving as families of people. So those are some of the things that we are working closely with other partners. And in terms of the improvement of access to ARV, that's something that we will have to be advocating and lobbying for with the Ministry of Health, to see that it is can be available at different levels of their service points. Those are the things that we would like to really work on, that emanates from this project.
Right. And do you sort of foresee any emerging issues that you, FJN Plus, may have to address in the future?
Thank you, Rita. But, this is one of the things that I've started talking to the staff about, is the treatment. Are we doing enough to remind our government, or to remind the people of Fiji the difficulties we might be facing 5 years down the road, or 10 years, that we need to prevent the transmission of HIV? Because as we have grown up knowing, prevention is better than cure. And we know that money is becoming very slim with donors, the focus. And one of the issues that has been raised about the Pacific Island countries, we are low prevalent countries, so there's really no reason for people to put their money into the Pacific. But we're fighting. We're saying, if you don't look after us or you don't support us, the Pacific might no longer be there whatever
Mm-hmm.
number of years. So I think that's one of the challenges that we have now is in terms of funding and making sure that education and information on HIV is continuously spread around the country so people take note and be able to change behavior and attitude.
Mm-hmm. And you also have champions, people who have been identified who champion this whole issue of HIV/AIDS. How effective has that been? And if you look back over a number of years now that we've had HIV, champions on HIV, not just here in Fiji but also in the Pacific, how effective has that been?
In terms of informing the people of HIV and also being able to see that a person living with HIV standing in front of them, to some extent, I believe it allays the fears that people have. Yeah? And so for that, for us, it is working. But it's something that we will need to learn how do we measure this and how do we manage it for longer so that it reaches out to as many people as possible. Eh?
Okay. Before we end this program, Joelle, any final comments?
Maybe I'll ask Open Rita. Would like to thank you for this opportunity to share about this report. And also we would like to thank SPC under the Response Fund, especially to the public health team, and also to the interviewees for giving their time and sharing their their experiences in terms of treatment. And lastly, we also like to thank Fiji Community Development Program, who has kindly supported FGN Plus to continue the work in our country. And we hope that the listeners have found it to be very informative. And if you need more clarification about this report, please do contact us. Fiji Network Plus, we're based at the Old Government Pharmacy, Rodwell Road in Suva. And also you can call us on 3310-958, 3310-958, or you can reach us on our email at info@figinetworkplus.com, info@figinetworkplus.com. And for your information, this email is confidential. Naga.
Okay. Thank you very much and all the best with your work. And we've come to the end of the program, and the studio guests today with me were Joelle Dhalati, Advocacy and Education Officer, and Vani Dulaki, Executive Director of Fiji Network Plus. Once again, thank you very much. I'm Rita Narayan. Until next week, goodbye.